All right. Good morning, good afternoon, and good evening, everyone, and welcome to UCSF Center for Global Nursing's Impact Series. This series aims to provide a platform for our nurses and global partners to share their remarkable work, offer valuable insights, and inspire our global community. Following the presentation, there will be a short Q&A, so feel free to write your questions throughout the presentation in the Q&A box so they're ready for our speaker when she's done. My name is Rebecca Silvers. I'm the Director of Center for Global Nursing, and it is my pleasure to introduce this month's speaker, Marilia Diaz. Marilia is the manager of a multidisciplinary intensive care unit at the Hospital Auxilio Mutuo in San Juan, Puerto Rico, where she leads clinical operations and advances quality of care for critically ill patients. She holds a master's degree in education and management of critical care from the University of Puerto Rico Medical Science Campus and has been a nursing professor at Sacred Heart University in San Juan since 2008. Marilia is a wonderful person, but also a respected international nursing speaker and educator who has presented all around the world. She's the past president and former secretary of the Puerto Rican Society of Critical Care Medicine. And in 2019, she became the first nurse living in Latin America to be named a fellow of critical care medicine. She continues to shape her field through leadership as the secretary and president-elect of the Central America and Caribbean Council of Intensive Care therapies and continues to strengthen intensive care practice across her region. In addition to her clinical and academic leadership, Marilia serves nationally and internationally through her roles on the membership committee of the Neurocritical Care Society, the Diversity and Inclusion Committee of the Society of Critical Care Medicine, and as a member at large on the Society of Critical Care Medicine Nursing section. At the Center for Global Nursing, we are proud to have Marilia as a member of our Global Nursing Advisory Council. And in 2026, for those of you joining our Certificate in Global Nursing program, she's doing a presentation on disaster preparedness. We are honored to welcome Marilia Diaz as this month's speaker for our Global Nursing Impact Series. And Marilia, I will hand it over to you. Welcome, and we're excited to have you.
Thank you so much for that presentation, and thank you also for inviting me to be here with you. So let me start up. Okay, so we're going to talk about a little bit about how nurses make an impact. And you can look up where you're from, but I'm going to tell you where I am from. And is this small, tiny little island in the middle of the Caribbean. We are really, really small if you compare it to many of the countries of the world. So this is where I am right now in the Caribbean, in the sunny Caribbean, while other people are in winter. We are in a sunny place. And when I got the invitation to be with you today, I thought, well, have I made an impact as a nurse? Have I really made an impact? Let me think about it. And I took some time to think very thoroughly this topic. And I decided to work it as an equation. So how can any of us as nurses can make an impact? And it is just a simple equation because I love math. I don't know why, but I do. And it is X, which is a good nurse, plus Y, which is a good leader. And you add it up and you get a nurse who is able to make an impact. What a good nurse must have? Well, communication skills, not only verbally, but also in the written communication. And the most difficult part, which is do some active listening. It's always hard to listen, to really listen to all the people, because you probably have so much to say as a leader and as a good nurse that you need to keep in mind to listen to your patients, to your family members, to the community, to other nurses. You need to have empathy and compassion, to do some critical thinking and problem solving, have attention to detail. And as Rebecca told you, I am an ICU nurse, so detail is my thing. Everything has to be perfect in my patient room. Everything has to be perfect in the ICU. You really take into detail when you are an ICU nurse. You need integrity and advocacy, And you need to be able to keep on learning. Learning is a continuous role throughout your professional life, and you gotta keep learning every single day. But when you think about a leader, I thought of a few words that describe a good leader, which are vision, courage, communication, once again, steps in, flexibility. You need to influence. So now we are in the time of the influencers, mostly social media, but you have to be an influencer where you work. You have to be an influencer as a nurse, and you need to be an influencer for the rest of the world, but in a good way. And you need knowledge. But then how you stand up in a crowded room full of nurses, and you need to be heard. So have I made an impact? Well, this is the sign for the visiting hours in the ICU. This is actually the visiting hours in the ICU I work right now. But that was our sign for years ago, in the dinosaur era, which was more than 15 years ago when I started there. And by that time, I look at everything. I said, we have a problem with those visiting hours. And we definitely need a new policy. It has to be changed. We need a change into our visiting hours. So I started up by just reading everything I could get my hands on. After I got educated on everything I could read about, I went to the ICU director, I went to the hospital administration, and I said, you know what? We need to make a change. It took me years, but after many years, we got a new policy with flexible hours for the ICU family members. And I was really happy about it. I made an impact. I changed the ICU. That was my thing. I was so happy I did it, and COVID hit. So now we're in a lockdown. The ICU is completely closed. Nobody gets into the ICU unless you're a healthcare professional and you're going to work there. Otherwise, you cannot get it. So I was back to square one. Once again, I had a problem. Once again, I needed to read whatever I could get my hands on, which was not that much, because COVID was starting. So nobody knew about COVID. There were no articles about COVID. So we have to learn by experience, day-to-day experience. Once again, I went to the ICU administration. Once again, I went to the hospital administration. And just a few months after, we got to update the policy. The good thing, it was not only for my ICU, it was for all the ICUs in the hospital. And I work in the biggest private hospital in the island. We are around 450 beds. I know it's not that much, but it is when you are only an island for 3 million people. So yeah, 450 is a lot. It's a big hospital. It's the biggest private hospital in the island. And the visiting hour policy for the ICUs changed for all the ICUs in the hospitals, which are around 5 or 6 ICUs. Can I make an impact then? Well, yeah, definitely. I did make an impact. It was a small impact. It was just the beginning, but I needed to begin somewhere in order to be where I am today. And even though I don't like to talk about myself, that was my beginning. That was what gave me the confidence to be here today, and what gave me the confidence to continue doing impact around the world. And there are different ways to make an impact. First of all, you need to give your time. You need to be open to invitations from anyone who needs help. Even if it is a small hospital in a small country, it doesn't matter. You're going to make an impact. I have even given lectures only for a group of 10 nurses, but I try to make an impact just for those 10 nurses. And maybe I won't make an impact on all of them, but if I impact one nurse, my job is done. And by making an impact on other nurses, you are doing it for the whole country, because you're changing the way people thinks about things and the way they react to what they have in hand. By giving your time, you let people know that they can think of problems that they can work on and make changes. So if you think, oh, that's an invitation, should I take it? Should I not take it? Should I speak to those nurses? Should I not go ahead and do it? It will impact you on the way you see things after you give a lecture to only 5 people, 10 people, and you see the way they react after you're done and how much they change just from listening to you. You have to become a mentor. So that's me. That was a few days ago. I am the old supervisor. Well, no, the experienced supervisor, not the old one. Okay. And that is a new supervisor I have on the ICU. And other thing that I have done to make an impact is to help people grow in the profession. I see a nurse, I work in an ICU, I am the ICU manager. So I especially look at people who are leaders and who can grow up to be leaders in the future. Because you start by being the leader of a small group and you can grow up. So that's what I do. I keep my eye open. I get who can I help to grow in the profession. I take them under my wing and I let them grow. So this is the third person I had made an impact because they have told me I made an impact on them by helping them to get confidence on themselves and thinking that they are leaders, that they can be leaders and they can work in a leadership position. She's just starting. It's been rough. The first days are rough. The first month are rough, but we're getting there. So being a mentor to others, it's really, really important. You need to be an advocate. And I said it when I was talking about how to be a good nurse. You need to be an advocate if you want to make an impact. And many of us can see a lot of articles about the benefits of the family presence in the ICU. But even when there is all the data, the hospital didn't look at it. They thought everything was okay because nobody complained. So if no family members complain, what should they change? Well, they should change because it's a benefit for the patient. And you have to make everybody see the benefits of having the family presence in the ICU. Because they only see the bad things. Oh, maybe our infections will go up, or maybe they will be on your way when you're working with a patient. Oh no, go look for the positive things, present it to others, advocate for your patient, advocate for your country, your neighborhood. Maybe just a small group of people, but you have to be an advocate for them and let their voices be heard. Lead by example. Don't pretend that everybody is going to do the work if you don't get your hands on and you do the work. it is easier from behind a desk than when you get your hands on. But when you have your hands on your work, it is a lot fulfilling. You get so much empowerment from doing it. You feel happier when you're doing it. You get passion from doing your job because you are working hands-on. And even if you work behind a desk, in a way, that's what I do. I work behind a desk, but I never forget to keep my hands on. So every single time I step out of the office, I'm looking for patients and I'm looking, how can I work with them? How can I help them? And all of the other nurses see it and say, you know what? If she can do it, I can do it. So why not? So be always a hands-on person and create a legacy. When Rebecca introduced me to you today, she said that I was the first nurse living in Latin America to become the fellow of the American College of Critical Care Medicine. She's completely right. It took me a few years to make it because the policies had to be changed for Latin America. This is a little bit of politics, but Puerto Rico is part of the United States. So even though I'm a Latin American, I am considered a U.S. citizen, and because of politics, the policies for the fellow in American College of Critical Care had to be looked at in a different way. So it took me a few years for them to look it up and make changes, and I made it. I became the first one, and I opened a door for other nurses. So the next year, they have 2 other Latin American nurses applying for fellowship. And that's what you need to do. It doesn't matter what you're doing as long as you create a legacy. You want people to say, oh, do you remember Marilia who worked here? Oh, she was so good because of this, and that. You want to be remembered by others. You want to make an impact on your career, on your profession, on whatever you do every day. And this is a quote that I always keep in mind. Leadership is about making others better as a result of your presence and making sure that impact lasts in your absence. Today, I'm not working in the ICU. Today, I am at home with you. And I am so confident that everything is working perfectly in the ICU, even when I am not there. Because it is not about me. I have taught them how to do things. I have taught them how to be leaders, how to make impacts every single day on their work, that they are working perfectly without me. I can go into vacation and everything keeps working perfectly. And when I go back, there is no problem at all because I made my impact on them. And even if I am not physically present, it's like I am over there. So as I told you before, that's me right there in Puerto Rico. Even the star is bigger than the island. And those are a few of the Latin American countries that I have visited and I have worked with to make changes in the way they work as nurses, especially in critical care. So specifically those countries, I have gone over there and I have go over there and spoke about family presence, which is a topic that I have right in my heart, because I have been a family member of an ICU patient, and that changed the way I think. So I have gone to all of those places many times, speaking of the same topic, hoping on making an impact on those nurses and changing the way they think of having the family in the ICU. It's been tough. Not all of them trust what I say. Not all of them think that it is a good idea, even though there is the data right there. But my work is not done. I still have work to do on family presence in the ICU. So I still have a lot of places to go to change them and make them see how I can impact them and they can impact all of their patients by just letting all the family be there in the ICU when the patient needs them. I'm ready for any questions you have for me. And thank you once again so much for inviting me here and for making of your time to listen to me.
Thank you so much, Marilia. It's exciting to see your leadership journey and how through local policy, through your work in societies, and through your larger, Latin American community, how you've worked to create change, particularly for families visiting in ICUs. I know I've been as a critical care nurse, I've been to 30 countries visiting ICUs, and there's definitely a variation in policy. I've been to places where families are not allowed in at all, and they meet with a consultant in a room for 1 hour a day to talk about the patient, but they don't have that opportunity. And I think your ability to create change at the local and then the global level, and through all the different ways you inspire your staff to continue to uplift that is really exciting. I don't see any questions in the chat, but one of my questions for you is you have a big role in many different societies and the president-elect of the Caribbean Society of Critical Care. What do you think your role as a nurse, like how do you think you create impact? What is the role of societies in um, I think a lot of us get really involved in our hospital systems or in our government systems, but what is the role of a society and how does that influence care or how does that influence and allow people to create change?
So in Latin America, I think it's a little bit different from the States where nurses are thought as part of the care team.
Mm,
In Latin America, sadly,
mm,
nurses are thought to be at a lower level than other professionals.
mm,
So trying to step up, to speak out, it's and to feel empowered is one of the few things I try to get them to see that they can speak up,
mm,
that they are really part of the care system, and that they do not have to work under other people. So that's the biggest problem we have,
mm,
because if nurses feel that they are under the supervision of others, like physicians, or that they are less than the physicians, and not that we are part of the whole group, it's harder for them to speak up. It's harder for them to do changes.
mm,
That's why small changes is easier for people in Latin America. And that's why the way I see it, I saw it in the beginning, was to make small impacts. And that's what I try to teach them. Do a small impact in your hospital, in your ICU, and then you can move on and feel empowered to go ahead and do it for your whole country, for the whole society. Um, I know it is a Latino thing. I know, I have seen it. I have worked with nurses from other places. I know it's not the same. I don't know if it is the way we grow up. I don't know if it is a thing that it's taught in nursing school, but it is a reality. And it is our biggest problem for nurses to make an impact in society because they do not feel empowered. They do not feel that they are enough when they are,
Mm.
and trying to change that way of thinking. It has been taking me a lot of years. I know I'm not the only nurse talking about it. There are a few, I have met a few, so we are all together trying to make changes, and especially the way of they thinking that they can make the impact,
Mm.
that they feel empowered to go ahead to speak up and do research and give feedback on what they found during those research. If you can publish, well, then it's even better if you can publish. But it is not something that in Latin America we are used to publishing. If you look up for articles written by nurses in Latin America, you only find a few,
Yeah.
just a few. It is going up. It is getting better, but it's taking years. So yes, it's really difficult for them to make impact in society. They don't feel enough empowerment to do it, but they are working on it. I have seen the difference, when you visit the same country 5, 10 years later, and you see that something has changed, there you go. You did what you have to do. And they even text me and say, I have a problem. I have this problem. How can I do it? So let's do some thinking outside of the box, and let's do a storm of ideas. And after you do it at a lower level, you can do it at a higher level. So
Yeah.
it's getting there. It's gonna take a few more years, I'm pretty sure, but it's getting there. I have seen the difference, and we're gonna get there.
Yeah, and I think it's inspiring. I know that there's historically so many hierarchies that exist in our healthcare systems and in our educational systems and for different things. And the International Council of Nurses talk about this all the time when it comes to a woman-led profession. There's just so many varied reasons, and culturally, there's many varied reasons. And working towards empowerment and giving nurses the skills to create small and large impacts, I think is incredible. And to your point, you will see changes slowly over time, and you're in the middle um, of a change. And sometimes when you're in the pot of boiling water, you might not notice it right around. But like you said, if you take time away, you can see bigger changes. There's two questions in the chat, so I just want to address at least one of them very quickly. The first one is, you said you created connections in other countries and were able to make an impact in ICUs in other countries and communities. Do you have advice on making those global connections and finding where specifically, like which hospitals or which people you can partner with to make the most impact?
Can you repeat it again? I'm
Yes,
sorry.
my English is way too fast, isn't it?
Yes, it was too fast for me,
I
actually.
apologize.
Sorry.
Um, I was like trying to get through the question, and then I realized. So,
Yes, the
just
first part I got it, but then it was too fast.
so what advice do you have for nurses or people that are looking to make global connections? Because you have many connections across Latin America. If somebody wants to work with the global community, how did you start that connections? What's your advice on creating connections to partner to make impact?
So actually, to make a connection is this easiest part of all.
Mm,
Yeah, by just saying, hi, I want to work with you, the door is open.
yeah.
We are more than welcome to new people that want to work with us. We are more than happy to have them in our team. Um, we do a lot of webinars and many things through Latin America, and we are always looking for someone who we can interview, or who wants to just have a chat. So by just saying hi, I want to work with you, I want to make an impact, just that. It is
Okay.
as easy as that. It's really easy to be welcome into our global experience. I work mostly in Latin America, but then I know people who does it in the States. I know people who does it in South America. I know people who does it in India. So it is about connections, just say hi to the first person and you'll get to the other one. Even if it is around the world, you're gonna get there by just saying hi to one person and look for the connections. Somebody once told me that it is not what you can do, but who do you know? And it definitely has opened the doors. So I know Rebecca, and I know I can text her and I need help for someone maybe in Italy. And maybe she doesn't know anyone in Italy, but she knows another one who knows someone in Italy. So it is all about connections. It is all about having the willing to do something. That's all you need to do. And, more than welcome and more than happy to have you with us in Latin America to work with us.
Amazing. I think I'm going to combine the next two comments. Thank you for your amazing presentation. I heard you talk about the nurse letting a patient in the ICU. I think they meant, Joe, I think you meant a family member in the ICU visit when a patient needs them. How does that affect the care of the patient, or has the approach been difficult for nursing? And Catherine then asked, what are the positive, have you measured the impacts of the family visiting hours? I know now they're Catherine, I think they're flexible now, so families can come at a flexible time. Is that the current state?
Well, yes, the current state it is that we have flexible hours for the family members to be in the ICU. We don't have metrics. Because to have metrics, I need to ask some permissions that I do not have yet. But we are working on it to have permissions to get some numbers and to give around some questionnaires so people can say, if how does it work and if it works well with them or not. But when you're talking about family presence in the ICU, they do not get on your way. You can do all of your work. Um, I have been in a room and a patient goes into cardiac arrest, and you don't have to say you need to tape out. They do it. They just do it. They see you giving CPR and they just step out. They do not get on your way. They just want to be there.
Mm.
And they are always asking, the family members are always asking, I'm on your way. Do I need to move? Uh, do you need to go this way? Do you need to go the other way? Which way is better for you? They are never, never, ever, ever on your way. Yes, there are some difficult family members. Yes, once every other time there are. But that is when your leader needs to step in and say, these are our rules, because you need to have rules. You follow your rules as a family member. We'll do our thing as nurses, and it will work out. So it's just about communication. And as long as I know, there has not been one single time where there was a negative thing for the patient while having a family member in the ICU.
Amazing. Well, I know that this we could talk forever about this exciting topic, and I just want to thank you for sharing your leadership and how you started to create change in maybe a place that the door was not just wide open and you had to create these opportunities. And so looking at your journey to learning how to create change in your ICU as the manager, and then at the societal level, and then at national levels and international levels, I think it's really exciting to see how nurses can create an impact with skill sets such as yourself. And if people have more questions, Marilia is always available via email or other things, and I can connect you. She will be presenting at our certificate in global nursing program on disaster preparedness, because as she just talked about, she is on holiday in Puerto Rico because hurricane season is over, and with an ICU and no power, she is an expert in that as well. So we just touched on a little bit of her skill set today, and we're so grateful for her joining us. Thank you, everybody who listened in, and this presentation will be available on our YouTube channel. So thank you guys for everything. Thank you, Marilia, for joining us, and I wish everybody a very wonderful day. So thank you.